If I was to ask you, what is the most disabling health issue in the world today? Many of you may say it's heart disease, stroke or trauma. But actually there's another condition which can affect your simple everyday activities like walking, sitting, sleeping, traveling, and sometimes may even force you to resign from your job. That condition is actually back pain. Today, over $100 billion is spent annually around the world just to manage this problem. Research shows that 80% of all people experience back pain some point in their lifetime, and 20% of them continue to have pain throughout their life. Back pain is really hard to manage because it is difficult to identify which anatomical structure or pathology is causing the problem. Initially, we thought that degenerative changes of the spine are the main causes for the problem. But now we know that degenerative changes cannot explain the symptoms. And there is no single effective treatment for pain because response to the treatment is different from person to person. And the treatment is mainly based on the severity of the symptoms, which is totally subjective. So to solve this problem, what if we can develop a reliable, objective assessment to explain these individual differences of symptoms and treatment response? On these grounds, we searched literature and we found that there is a growing body of evidence pointing to genetics to explain these differences. To test this hypothesis, we recruited a group of patients with back pain and followed them up for 3 months. We collected their baseline and follow-up values on pain and disability, and we assessed their degenerative features of the spine with X-ray and MRI. We collected venous blood and did genetic testing on them using a validated technique to identify 62 genetic markers based on the Sri Lankan genome. We then analyzed the association of these genetic markers with the degenerative features of the spine, symptoms, and response to treatment. Our findings were really interesting. Most of our patients had degenerative features of the spine, but they did not explain the differences in pain and disability. But we found 9 genetic markers which affected these degenerative features of the spine, and some of these markers could explain the variability in symptoms and response to treatments. With further confirmatory study, we can use these genetic markers to identify individuals who would be at risk of back pain, and we can advise them on how to take necessary measures early in life to prevent the development of back pain. Similarly, because we can also predict their response to treatment, we can optimize the management and prevent the complications. In keeping with the age-old principle of prevention is better than cure, our findings have the potential to save billions of dollars and reduce the global burden of this condition.